Okay, so I'm Dr. Claudia de Moral. I'm a radiologist and I specialize in breast imaging. What I mostly do is read mammograms, perform ultrasounds, and when we find something that is suspicious, then I also perform biopsies either with ultrasound guidance or with mammography guidance. Well, there's really not that good statistics in Mexico about this. I have looked and all that I can tell is that breast cancer is still the first cause of death in women in Mexico, and as it is in most of the world, 1 in every 8 women will get it. It's interesting to know that it's supposed to be that Latin women, we have this gene that is supposed to protect us, but then we have so much obesity that we are up there with every other country, so it's a very common disease. Well, the risk factors, this is a two-part question, I think. The risk factors would be mostly those related with hormones. So when you get your first period very early, like before 12, when you have your menopause very late, when you don't have children, when you don't breastfeed, whenever you take hormones for whatever reason, I mean for getting pregnant or for not getting pregnant or to regularize your cycle or to the hormone replacement therapy, all of those hormones that you're putting in extra are increasing the risk. And well, of course, there's the risk increases with age, and there's also, of course, the genetic factors. When you have someone in your family that has had breast cancer, and the closer she is to you, then the most the risk. Well, after the risk, I would have to say that there is really no prevention for this disease. Everybody can get it. Every woman out there can get it, and there is no thing that can prevent you from having it. Even if you exercise regularly or eat very healthy, you can still get breast cancer. Even if you have never had kids or if you have had 20 kids, you can still get it. 75% of the people that get breast cancer have no known risks. Well, speaking about the myths, most myths are relating to the mammogram. Mammography is the only way to find it early, to find it when it's really curable, when 95-98% of the women will get cured if we catch it when it's really, really small. So the only way to catch it when it's really, really small, it's with the mammogram. And most of the myths relate to the amount of radiation, for instance. People are very scared of radiation. They think that if you radiate your boobs, then you will get breast cancer. But that is certainly not true. Mammograms were invented to prevent death from breast cancer, not to cause breast cancer. And there hasn't been one case proven in the whole world that has been caused by mammograms. The radiation that we do for mammography is about standing 20 minutes in the sun in Puerto Vallarta. So how many of us do that on a daily basis? So radiation is not a thing with mammography. We also do the compression. The compression is one of the other myths. People think that we compress too much, or that the compression can cause cancer, or that the compression can cause the cancer cells to explode and go all over your body. The truth is that we need the compression. The compression serves many purposes. One of all is to diminish the radiation that we need, because it's not the same to go through this amount of tissue than to go through this amount of tissue. We need less than half the radiation when we're compressing. And also, we're dispersing the tissue. We cannot find anything when the tissue is compressed because everything will be hiding inside of the tissue. So when we disperse it, it's easier to find abnormalities. And also, we're looking for things that are really small, I don't know, like a particle of dust. And to see something that is so small, we really need the boob to be really stable. We don't want any kind of movement, because otherwise we are not going to be able to see those things. So we compress to keep the boob on its place while we're doing the mammogram. What else about the myths? There are a lot of them. A lot of people.
Painful,
yeah, I think pain is one of the. I wouldn't say myths, because it is painful.
Yeah.
I mean, we have gotten that, we've gotten it, and we can tell that it is painful. But I mean, it's 5 minutes of pain once a year that can save you from 1 year of chemotherapy. I mean, that's a good bargain.
Sure.
And how many of us do things like pick at our eyebrows or wax our, do things that hurt, and we do it every month or every 2 months. And this is only once a year, and it's 5 minutes of your time once a year that can save you a lot of trouble and a lot of heartache. Well, that is a gray area. I mean we as in the royal we, the breast imaging community in the world has decided to set the date to start doing mammograms at 40. And it is not that something happens when you turn 40 and then all of a sudden you have more risk. But it's been proven that that you can get breast cancer at any age. If we do mammograms in the 40s, like from 40 to 50, we will catch about 30% of the cancers that we're going to catch. And these women will benefit the most because we are going to save the most years of life. So we're starting at 40. There is no age to stop. As long as you're healthy and your expected life is longer than 10 years, then we recommend that you keep doing your mammogram, because if we catch a breast cancer early in your 70s, we can diagnose it, treat it, and you can keep on living for your 10 or 20 years more without having to die of breast cancer, which is a horrible death. And well, for younger patients, we do have younger patients with breast cancer, and we can do mammography on younger patients. It doesn't matter the age, but we usually start with ultrasound in patients younger than 40 because the risk is lower, and because if we were doing that many mammograms, like every woman in their 30s, we would be doing thousands of mammograms to catch one breast cancer. So it's risk benefit, and we're not doing that. Regardless of what insurance or not insurance you have, regardless of if you are wealthy or if you are very poor, the thing that is going to determine how much time, energy, and money you're going to spend of this is the time of diagnosis. If we find it very early, it will just be a surgery, maybe some radiation. If we find it late, it can turn into years of chemo. So that's a very, very important thing to say. You need to catch it early, because then it's gonna be a world of difference money-wise too. Self-breast exam is the other thing that we do encourage every woman to do, and that should start at 18. It's not just because at 18 you are most likely to start getting lumps. No, it's just to start getting your hands to notice things. Just get them to feel and to understand how you normally feel, so that when something is abnormal, your hands will notice without you even thinking. So I hear a lot of patients asking me, well, I don't know how to feel, or I always feel like a lot of lumps, so I just don't do it because it's scary. But the truth is that the more you do it, the more your hands learn. You don't have to really be aware to be thinking, am I doing this right? It's not about doing it right, it's about doing it. Once you've done it 10 times, your hands already know what they're looking for, and you don't have to be thinking about it. Your hands will know. It's like when you have something new in your bag. If I throw something inside of your bag and it's something that you've never had, your hands will reach in and feel something different and pull it out, just without you even thinking about it, because your hands know what's in your bag. So it's the same. Your hands have to learn how your boobs feel, so that when there's something new, they will know. Well, male breast cancer is, as you know, not that common. It's about 1.7% of all the breast cancers that we find, but it happens. And it is very easy for the men to detect it because there's nothing there. There's no breast tissue to confuse your hands. So if you once a month touch your boobs, it's very easy to notice if there's something new. So that's what we always tell male patients. It's unlikely that you will get it, but it will only take 1 minute every month to notice if there's something new. So just do it. Well, I think that is a very complicated question. First of all, there are a lot of different kinds and aggressiveness of the treatments in breast cancer. It can be as small as just having a small surgery and then you're done, and as it is battling with it your whole life. So it is difficult, and it is difficult in the setting of the family. It is difficult to explain to your kids. It is difficult to power through with your husband if you have one. It is very difficult to go through it alone. I really cannot tell you that there's a magical way to do it better.
Look,
of course.
Yeah, throw something in here. I mean, every woman that we deal with that has breast cancer usually work that they have a good support system. As far as special diets and things, that's really important for the person to speak with their oncologist about. Because if they take up a special diet and they're on chemotherapy, it can affect the chemotherapy and have a bad reaction. So any of those kind of changes need to be spoken about with the oncologist. We have several
support groups, right?
Yeah, well, there's a big support group in Spanish, Benú.
There's, I would say, 3 or 4 different kind of women regarding their insurance and stuff like that. First, there's the woman that has absolutely no health insurance, and they can either go to a private oncologist here, and there are very good private oncologists here, or they will have to go to Guadalajara to el Instituto Nacional de Cancerología, where they would be treated there. But it would be in Guadalajara because I don't think they treat breast cancer here in Hospital Regional. Then there's the women that have IMSS. When they have this IMSS, they can have some of the treatment done here, but a lot of it goes again to Guadalajara, to el Centro Nacional de Occidente. And then there's the women that have insurance, and they usually go to one of the private oncologists here. Some of them decide to go somewhere else. I have patients that have gone to Guadalajara, to Mexico City, and even to the States or to Canada, depending on what kind of insurance and what kind of probabilities they have. But it's depending on every woman.
It's back to what you talk about, Antonio, a lot, that we always tell the people, is the difference between the public sector and the private sector. If the public sector, the treatment's not going to be as quick, or maybe not as up to date, and it won't be locally. The private sector, we can do everything here but radiation. The patients go for radiation either to Tepic or to Guadalajara.